Thank you.
I would now like to invite Professor Angela Ofori-Atta to please address us. She is the chairperson of the Psych Council and founder director of Psych program for National Service Psychology graduates. She is well known for her published literature and pilots culturally appropriate delivery in mental health. I request you to please address us, ma'am. Professor.
Well, thank you. I'm really honored to be in the company of so many distinguished women and our most reverend, revered host. Madam Chair, I think I was in the International Women's Conference in, would it have been in South Korea in 2000? No, yes, in about 2004, 2005, perhaps. I'm not sure, but it was an International Women's Conference, and I was very inspired by it. And I congratulate you on the choice of theme of looking at domestic violence in the day of COVID. I have to say that in Ghana, it isn't that we don't have a problem with domestic violence. It is that we don't have the statistics. And if we want to know the extent of the problem, we have to go and look at some of the studies, academic studies and so forth done. For example, we have one that says about a third of married women in a sample of 1,400 have reported domestic violence in their marriages. I think that's a fair proportion to say. But domestic violence is not only between men and women, as we know. It's unfortunately violence towards children as well. I think that it is WHO that at some point declared that we have an epidemic of domestic violence around the world and in Africa especially. But since we don't collect the numbers, we don't know the extent of the problem. And we have to we have to look at the prevailing socioeconomic factors to project whether it's going up or not. And we do believe that at this time, it is going up. We have been in a lockdown for 3 weeks. This coming Sunday will be the end of the third week. And to ease the economic pain, because the economic pain is likely to lead to extra violence, government has put in place many measures, both economic and medical measures. They're pretty much in line with what most of the world has done, except that it did. Ghana took these decisions very quickly, and so has probably forestalled much of the spread of the virus. But I would like to concentrate more on domestic violence, as the distinguished panel has done. And I would like to take it from the perspective of psychological measures that we've done over the years, not just at this time. I'd like to say that, for example, we had a domestic violence law passed in, say, 2005 or 2006. Hotly debated, of course, for quite a while before it was finally passed, but it does exist. To back that law, we have had, or even before the law was passed, we've had police domestic violence units across the larger municipalities. And we have been involved in training sets of police, but you train them and then they get dispersed into the larger police force. And then you think perhaps their impact is not felt as much. But then the other side of it is that then they go and hopefully infect the others in different police forces. And I think those domestic units are working not at the level that we would like them to, but they exist. As well, there's been various training of doctors and healthcare professionals to recognize what constitutes physical domestic abuse on both women and children, to help with the examinations, to do the reports and refer back so that police prosecutions can proceed. And then there have been various radio shows and discussions on them, but they sort of have come in waves, come and gone. And I'm not sure that we're riding such a big wave of public awareness and discussion at this time. And it will take, say, a professional association of lawyers who have in the past been wonderful at raising awareness to bring it back on the table. It will take the Council of Psychologists and the Association of Psychologists and Lawyers and so on to bring these waves of increased violence to the fore. So I think moving forward, what we have done in the departments of psychiatry and amongst the councils is to have call centers for people to report not domestic abuse. We said psychological distress, anxieties related to the times of COVID. And I think that because we were blindsided in not saying domestic abuse, we have had very few reports of domestic abuse. We've had reports of anxieties, of depression, of relapses, but no reports of domestic abuse. And I think that that's because we have not gone out and said, come, let's talk about what's going on. So I think that one of the ways traditionally that we have a protective factor in our communities is the fact that we live in extended families. And so if there is a problem of domestic violence over and above what is accepted, and I'm sorry to say that there are many societies that believe in, not that they believe in, but allow a certain level of abuse. But when it goes beyond, then people step in. And so because we live in extended families like that, the level of excessive abuse is I believe, is not as much as it would otherwise have been. And then we have the traditional setup of the queen mothers and the chiefs where people can go and report in their communities to their elders and queens and kings and say, I can't live with this relationship anymore, or this is too excessive. So there is some kind of a conflict resolution mechanism and some authority within societies and communities where excessive abuse, as is recognized as abuse, is addressed. So these are some, small strengths within our traditional societies that help with conflict resolution. And then we have the faith-based organizations where people also have an outlet in reporting to their pastors and so forth. I know the problem with the community and sometimes the faith-based is the gender inequity, the way the relationships are looked at as the man being more superior than the woman and more important, whose face is to be saved more than the woman's face is to be saved. those exist. And I think the work that we need to do as professionals is really bringing the gender equity to the fore and saying, look, maybe this level of tolerance is too much even, and that we need to say no to both the psychological distress, the psychological abuse, the emotional abuse, as well as the physical abuse. And I think that is the work that we need to do. Apart from that, I have to say that I'd like to mention that my mother was Ghana and Africa's first woman pilot, and this was in the 60s. And she was an Air Force pilot. So for us, we have had these amazing icons. We've had women writers, scientists, and so forth, right from the 50s and 40s. And this has translated, this has come about because of education, women being allowed or pushed through education, or being expected to be in education. And that has persisted. I think in today's Ghana, we probably have gender equality in the lower classroom, where all children come to, or most children come to class 1. But as we go towards, let's say, as we move into middle school and tertiary education, secondary tertiary education, the balance kind of changes, as with most countries. And I think there's work to be done there in the middle and tertiary places to bring about equality. And then finally, I think the municipal authorities will need a little bit of encouragement because they control the markets. Now, why do I mention the markets? Ghana's informal economy is 90% of the total economy. And so informal markets play a very important role. And women, they dominate in our markets. And yet our markets haven't been given the attention that they need, because it's the economic base of trading women. And so yes, I think that would be the next step, where we focus on getting that economic empowerment to the next level, banking systems and legal systems that will help build the trade of women.
Thank you.
Thank you.
Thank you so much, ma'am, Professor, for sharing with us and for emphasizing that gender equality in education right from the beginning, extended families, faith-based organizations, traditions of the elders, joint families can all help to alleviate these problems.